Could have robbed me.
All right.
Sure.
Elvie producing today. Say hi to Elvie, everybody. Say hi to Elvie. Before we go on,
What
there
up?
she is. 1 year anniversary of your show, right, Indie Gems?
Yeah.
Congratulations.
Thank you, thank you. No, I'm just trying to be like the big dogs.
Oh, yeah? This show's been on since 1999. Add those years up. How long is that? That just means old man.
Damn, bro, that's like 18 years.
Right. How come I can't hear it out here? There?
No, don't. Oh,
Here we go.
you're not like that.
Welcome to Couch Live here on WJHM102jams.com. Hello, everybody. Rock100DIZ.com. And, of course, the Problem Solving Network. Still trying to get comfortable here. Look at that. I always got to move this around because Trinity's face just ends up right where that is. I don't know where to put this, Trinity, where I can see you without it blocking.
I don't need to be seen. I'm all right.
You don't need to be seen? Oh, wait a minute. I can't hear you. How about, do you need to be heard?
I don't need to be seen. I do need to be heard.
Okay, there. You're potted up
Some
now,
might
so you're
debate
good.
that too, so who knows?
Right. I'm always trying to move those around. Anyway, welcome to the Couch Live. We have Elvie in here today producing for us today.
Elvie. What's
Elvie.
going on?
What's up,
What
Elvie?
up?
Elvie from Indie Gems over there on, what station is it on?
WJHM 102
Same station.
Oh my God.
You know that.
We're in the presence of royalty.
What is it? WJHM102jams.com. What's on multiple stations, so I got to make sure to tell everybody it's not on this station. If they're listening to this show on rock100diz.com, they're not going to know.
Yeah.
So it's on WJHM, right?
Yeah.
All right. Did I do the wrong one? Let me see. There you are. Talk again.
Hey.
No, her. There you are. There's Elvie.
Your headphones are messing with this thing.
Is it
you
mine?
have some powerful headphones.
These are bad. Bad to the bone. Bad to the bone.
Yeah.
Headset. Are you sure it's mine?
They look like Facebook headphones because they got a big F on the side.
Yeah, they do.
They
Fila.
do look like
They
the
look like
Facebook
Fila.
symbol.
Like
No,
Fila.
that's totally the Facebook symbol.
Is
Oh
it?
God.
Wait.
You sure that's mine? Something else is going on. Look, oh, I can hear myself out here. That's what it is. Whatever's going on out there. Look at that. Don't you just love when there's a little technical difficulty? I love it. It's not a big deal. All right, so let's get going. This is a show that focuses on addiction and recovery and all the things in between. I am the street certified dope Dr. Louis Delgado, here with my cast of friends. Hello, everybody. And we have Trinity, the Dharma guy, Phillips.
What's going on?
You. And then we have the intern, Robbie Barrett.
What's up? What's up?
Still hasn't earned a nickname yet, even though Trinity's pushing for the professor.
Ooh,
I
Yeah.
am.
cool.
And then who's that in between you guys? Reese? Reese, the other producer?
The dope dog.
The dope dog. Uh-oh. That could mean a whole
That was
different-
clever.
Yeah,
I
that
like
was
that.
pretty good. And then, of course, Elvie, our producer for today.
Hello.
There we go. Elvie off camera, though. See? Elvie,
We can't all fit in on
can't
your
all fit in on that little screen, huh?
You need like a tablet or something.
No, you just wait. There's things coming, Elvie. There's multiple camera angles and everything coming soon. How soon, I don't know, but it's coming. I saw the new board, Elvie. Wait till you see it.
Oh, wow.
Saw the new board I want. New mixing board. I'm going to put it in. Right now. I'm going to do something.
You gonna mix it up?
Mix it up. So anyway. So we just came back from our Now Matters More Foundation meeting. We were over there just catching up with some old things. For those of you that don't know what that is, go to nowmattersmore.org. And you can learn more about that, how to help out people that are currently suffering. We help guide people to the right treatment centers. Of course, asking nothing from you, asking nothing from the treatment centers, other than that they just do a good job. That's it. Sometimes we do some partial scholarships, sometimes full scholarships, and of course sometimes treatment centers actually scholarship beds. So sometimes we know about that. But if you know somebody that's suffering with addiction or recovery issues and needs help, whether it be outpatient all the way to residential or detox or medical detox, please give us a shout by going to nowmattersmore.org and finding out how maybe we can help you, guide you. There's a list of resources on that page which detail treatment centers that we've already vetted. And what we mean by that is basically we've already visited to those treatment centers, know the people involved with those treatment centers, and trust them fully. So if you have any issues with the treatment center that you're dealing with, let us know. We'd love to go vet them and check them out. And if they suck, we're going to say they suck. Hope you don't mind. And if they're good, we'll say they're good.
And on a side note, while you're at the website, go to our store and get the new limited edition Kyle Weatherman shirt.
Yeah, why do you sound so low? Are you not speaking close to the microphone? Because I can hear you all the way up.
I couldn't get any closer to it. I could eat it, I guess.
Only Trinity can say that and get away with it.
Only he has a big enough mouth to eat it.
There you go.
So,
I will say our lovely intern here, Robbie, did buy his shirt this morning, so that was awesome.
Robbie's going to be sporting his Kyle Weatherman shirt.
Did you get the white one or the black one?
I got the black one.
Absolutely. The black one is awesome.
Yeah, you have to go with that.
Yeah. I think I'm a fan of the black, and I think Trinity's more a fan of the white.
I like them both.
Oh, really? I thought you just like white shirts because, the sun.
A little bit, yeah.
He
Black
tries to do
shirts are so
anything to
hot.
repel sun.
Yes, I try.
Right. All right. So anyway, so what's in the news, Robbie? Let's start with that. Addiction recovery news. Anything?
Yeah, we were talking about Tiger Woods last week.
Oh, boy.
He checked into treatment, so that's a positive note we're starting out on.
It is. You
Yeah.
finally, you listen.
Tiger in
You
treatment.
listen. You brought some positivity.
It's his third time in treatment, I think.
Yeah.
I still want to see Trinity on this Facebook Live. If you're watching on Facebook Live, I apologize. I can't seem to angle this where I can see Trinity unless I go way over here. Way over here.
It's got a mind of its own.
I'm going to move so I can get you. I got to get you in there. I don't know. I got to get you in there. There you go. Look at that. Look at that. If I sit way over here, you're in. Look at that, Trinity.
Whatever.
I got you, bro. I got you. I want to see you. I want to see your lovely face. So thank you, Elby. See, he's hooking it up. She knows how to be a producer. She knows how to do it. All right. So Tiger Woods went to rehab.
Yep.
All right. Is that it? Is the whole story?
Good job, man. You heard it here first.
All right. Good job, Robbie.
No,
And
yeah.
that's the show.
Yeah. And on to the show. How do you fill up an hour with news like that?
Oh, I got there's some other news from that site you sent me.
Okay.
That there's a heroin vaccine that.
No, I mean that's it with the Tiger. For real, that's it with the Tiger.
I mean, the
That was just an update.
The only other
Okay.
thing that I saw. I mean, the details aren't really out there. He didn't want to give a statement or anything.
But it's 4 pills, right?
Yeah, four prescription painkillers. So
that would lead one to believe then that the whole 3 a.m. incident revolved
Right,
around addiction. Then.
Well, you did see his eyeballs, right?
well, it was released that he was on Xanax and then hydrocodone. Yeah.
Both?
The
Yeah.
cocktail.
Yeah, both.
Ah,
The cocktail.
Yep.
that's disgusting.
Not the Houston cocktail, because you'd have to add a soma in there. A
Yeah.
muscle relaxer. You had the muscle relaxer in there, and that's.
He might not wake up from that one. But
Well, so yeah, the question then I wonder is the fact that they prescribe that and they put people on that, is that going to get attention, or is the attention still going to be bad Tiger Woods?
I don't know, because the thing is that he's had so many surgeries that you figure he just has these pills
Yeah.
lying around, and it's not like you can say don't prescribe him after surgeries, because
Right.
they do have a
Sure.
legitimate medical.
Right.
Yeah.
Absolutely. And it is Tiger Woods, brother.
Yeah.
So, initially it was hard for him to break into the mainstream. Being a black man golfing, that freak Fuzzy Zeller and the boys out early in the day.
Sure.
But as time went on, and as people got a little bit more understanding and just real
Yeah.
instead of crazy, he's part of American culture and history and legendary. So realistically, I think people are pulling for him. I think we want to see something positive. Here's the bad thing though, Tiger. You got to have like real positive things happen in between rehabs, so you stay on the positive note.
Yeah.
You can't just go have rehabs back to back without like a win or like a championship.
Yeah.
Because if you do a championship then a rehab and a championship then a rehab, it's a lot more acceptable, right?
Everybody loves a winner.
Right. Like when Robert Downey Jr. was just having all the negatives,
Yeah.
but without the hit movie, it was like, well, you can't do that.
Yeah.
But you can throw a hit movie in every once in a while, and we'll back you up, man. Now you come back as Iron Man, and boom, you're good.
Yep.
And that's the reality of. What I love is people are very forgiving to our stars, who have issues like this. And like you said, Robbie, I mean, you're talking. Here's the answer. He had legitimate pain, legitimate surgeries.
Oh, yeah.
These aren't made up things. And this is what I like about the story is this is how a lot of people get addicted.
Yeah.
Right?
Yep.
I mean, that's the
Oh.
common story of how people get addicted
Yep.
and how they get into things like heroin. So I'm glad that that's up in the news again like that.
Well, to me, that should be the story. It shouldn't
Right.
be bad Tiger. The story should be, look, this is what happened.
Yeah.
Right.
For sure.
Yeah, that's exactly what happens. All right, so what else is in the news?
So we got a heroin vaccine that's moving into clinical trials, which is pretty cool. And when I first heard of that, I thought that, how's that different than Vivitrol? People can't get high on heroin, but instead of introducing a part of the drug to the body, it introduces like a traditional vaccine, like an antibody that they'll put in like a certain molecule of heroin, and then your body will realize that it's like a foreign invader, and if that ever comes back in, then it attacks that rather than let you get high. So there were some concerns
What?
though that
How does that affect like
Wait.
pain treatment and stuff?
how does that affect what?
Like pain treatment.
Yeah, exactly. That was the number one concern. What if someone needs emergency surgery? Then you can't get treated for pain. There's no overriding it like there is naltrexone. So that's a huge problem.
You think?
Yeah.
All right, wait, can you repeat that? All right, so it attacks?
It uses the body's immune system just like other vaccines in it. What it does is they put a piece of the heroin molecule, not in humans yet, but in rats, and the immune system recognizes it as a foreign invader. So just like any other vaccine, they use a small piece of what they're gonna do. I don't really understand all the science behind it yet.
Right.
But
it's going to clinical trials,
like it's gonna be tested in humans.
which means some man monkey out there is going to get it.
Exactly.
All right. Well, that's good because there's people need. Well, I don't care what they come up with. Come up with something.
So how are they going to test the efficacy of that, though? Are they going to like shoot them up with heroin afterwards to see if it affects them, or what?
Yeah, you'd have to think so.
Wow. Okay.
Or just use other,
I don't want to sign up for that.
or use other painkillers. I mean, it doesn't have to be heroin.
Right. Thank you for that distinction, Robbie.
Yeah.
We have evolved a little bit. I guess any not analgesic, but any antagonist would work, right? I mean, no, agonist, any pain agonist would actually work.
Anything that targets the mu receptors.
Right. And that's what they're targeting, right? The mu receptors.
Yeah. And what I was thinking is they really just need to come up with some drug that kills pain but doesn't lead to dependence, rather than coming up with all these vaccines and crazy stuff.
Yeah. Right now there's a guy out there that says it's called the get over it.
Yeah. Well, that doesn't
Well,
work.
everybody feels pain. Get over it.
Sure.
Which is true for people that don't have legitimate heavy pain.
Yeah.
That's a fact. We really have a little headache and you can't deal with it. I agree with that part of it. But like your arm's looking sideways.
Yeah.
Or you got a broken back. That's different.
Yeah.
And there's a lot of that. So what else is in the news?
Well, we got that treatment center in California that the FBI raided multiple locations.
Oh, that was a funny one right there. First of all, I'm going to say hi to Courtney. Courtney's watching on Facebook Live. Yeah. All right, so here's the funny thing. Did you notice on that one? You know what? Wait a minute. There is that hollow. You know what it is? It's open above us. Can we turn down the sound outside? That's what it is.
Oh.
No, that's not it.
That was it.
No, yeah, that sounded better.
You think that was it?
That's
Yeah.
it.
I know what it is.
Of course you know what it is, because you're the producer. I'll pot you up when you're going to say something. You just tap me on the back.
But it was Sovereign Health that got
Sovereign Health. All right, Sovereign.
Yeah, why does that sound so familiar to me?
Because
It's
we know people that work
Yeah,
there.
okay, that's what I thought.
And they're around here, and they have a facility here in
Yeah,
Florida.
they're everywhere.
Yeah.
So here's what was funny about the way they put out that article. Look at the article right below it, Robbie.
Yeah.
Now, what is that article talking about? Go ahead and just give us a little update of that article.
It says that the CEO of Sovereign Health, Dr. Tanmay Sharma, to present at the Mental Health America 2017 conference.
Okay. So here's the funny thing, people. So here this addiction bulletin goes out, right, to people in the industry. And so the first article is about how Dr. Sharma is presenting at this yearly conference.
Yeah.
And it talks about how great he is.
Yeah.
Right? And then the other article is about how Dr. Sharma's place just got raided.
By the FBI.
By the FBI.
Wow.
Multiple locations, not just one.
Wow.
Whoever put that out, Addiction News Bulletin, who puts that out? Addiction News Bulletin,
Yeah,
is that what
Addiction
they're
News
called?
Bulletin.
Is
Yep.
that their name?
I think it is.
They
Yeah.
had to be laughing.
Addiction Recovery E-Bulletin.
Okay, they had to be laughing when they put that out,
Wow.
right? Because it's like, how do you... And I wonder, does he still get the gig?
There's so much, there's illegitimate, there's like all sorts of stuff about this doctor and how he had his medical license revoked and how he said that he was licensed in India but it had nothing to do with addiction and that
Right.
he claims to be an expert in the field, so there's a whole lot of controversy just with this guy.
So let me paint this picture. Again, 2 articles in the same bulletin that gets sent out. The first article talks about how this guy's such an expert in addiction that he's speaking at this yearly conference. The second one talks about how this physician just got raided, not him, the whole facility got raided, or multiple facilities got raided, but that he had his license removed in one area, not in another area, then he fought that, didn't fight that,
Actually,
whatever.
The first one is the FBI.
Yeah.
Well, yeah, I would,
It says,
yeah.
It says
yeah.
first
Yeah.
step, and then the right underneath it says should be
Yeah.
interesting.
Yeah,
And it shows
isn't that crazy? So let me see how that looks. Let me show you. So this is how it looks for the people on Facebook Live. If you want to, what do you call it? Go look it up. So this is it. That's the one talking about the arrest, and then this is the one talking about great old Dr. Sharma. Look at that.
Yeah.
So, I think that's hilarious.
So he was stripped of his UK medical license, and then he went to
Right.
the US, but
Right.
yeah, there's a whole lot of stuff going on with him.
And mind you, look, we have no opinions on this guy. None of us on this show even know Dr. Sharma.
No.
All we're doing is any of it.
Yeah. But
What
yeah,
were they rated for?
Yeah.
body brokering.
Oh,
Yeah.
Okay.
So they
more
were
of that patient brokering, which
Yeah.
is Trinity.
Bad.
So they were making $1,200 for drug tests, and then they were testing patients up to like 15, 20 times per month. So making $100,000 just off drug testing somebody.
And that
for a
is,
month.
and yeah, that's cool.
Yeah, just off urine analysis.
And they're not a lab. That's
No.
the thing. They're a treatment center.
Yeah.
Look, if a lab is making money off my urine, that's one thing. But a treatment center, that's a different ballgame. You know, and if you do it all right, so you make it off once or twice, but just 4 or 5 times a week.
Yeah.
They were drug testing people 4 or 5 times a week that are an inpatient. If you're inpatient
Yeah.
and you need to be tested 4 or 5 times a week, then you need to check your staff.
Well, no,
Because
that-
if I'm getting drugs while I'm in rehab, where you have to test me that often,
Okay.
your staff must be bringing it in.
Well, not only that, but if you're already dealing with anxiety issues, and then just being tested 5 times a day or 5 times a week,
Yeah.
I can imagine that's like not helpful.
No.
You mean like you have like urine anxiety?
Well, I just know people who are anxious about all sorts of stuff, man. People get anxious with the day of the week.
See, this is the bad thing, because I'm a strong believer in testing, and I don't want any facility to stop doing toxicology testing. And I think you should
5
test
times a week?
I think no. I think you should test for everything under the sun. But I think legitimately, twice a week covers every drug that's out there.
Yeah, and I think
Sure.
Yeah, I think you don't need a $1,200 drug test either. Most of your like 12, 15 panel tests will be like, and they can even be like $150, but $1,200 is just
Well, here's what it is. I'm going to put a guess here.
yeah.
If you send it to a lab, $1,200 is cheap. But $1,200, I tell you exactly what they did. $1,200 equals $100 per panel, meaning a 12-panel test.
Yep.
So they took a 12-panel test, a cup that cost $4.50, billed out $100 per panel, which is $1,200, and billed that.
Wow.
That's what they're talking about. Now, mind you, they're not getting. But listen,
Yeah,
let's not
it's
get it
like
twisted. They're not
they're-
getting, but they're not even receiving. No, that's 3 years ago and beyond. 2 years ago and beyond.
Yeah.
That all stopped. They're not. The insurance companies are no longer paying that much money per drug test. Whether you have a CLIA waiver license, whether you have a CLIA license, whether you're a lab or whether you're a treatment center, it doesn't matter.
Yeah.
Those days are over. So they're not getting all $1,200.
Sure, but they
No.
are getting a healthy sum.
But the point is that they're testing 4 or 5 times a week, which I don't care if you're getting $5. If you're testing 4 or 5 times a week, that's over testing.
Yeah. But I mean, the truth is there are people in treatment that are using, and
That's why I said
not-
twice a week.
Yeah, twice a week.
Twice a week. I would always test at least twice a week.
Absolutely.
Because you can catch anything, even cocaine there twice a week. If you randomize it, you're going to catch even cocaine at twice a week.
Yeah.
Even alcohol, if you're doing the right test.
Yeah.
You will catch it. But, like I said, anyway, it was more than that. The patient brokering, basically, for those of you that don't know, what that is paying somebody for bodies. So it's saying, hey, look, we put people in treatment all the time. You know how much money I would have if I get money for every person I put in treatment? Oh my God. That's all. That's. Sure. Is that the phone? Tell them I don't want them. Can you imagine that? If you're getting between $1,500 to $3,000 per body,
That's crazy.
that's a lot of money.
That's why people are doing it.
That's why they're doing it.
Mm-hmm.
And if that's all, if they were just paying for that, even I would struggle with the ethics of that part. I don't know. But it's when you take that and then start paying people to go to treatment, or paying for their insurance so they can go into treatment, or paying people that are in one treatment center, $500 or whatever, so that you can then put them in a different treatment center and collect. That's when it's that's when it got bad.
Yeah.
Because you don't even care about their sobriety.
Right, but if you would
It's
just
all
tell
about
me paying a marketing person for, that's normal marketing, right?
Sure.
I don't know. You could probably make a case there. Where you can't make a case is when you start taking it even further and start
Sure.
paying clients to go. That's when it really gets ugly.
Mm-hmm.
And that's when I've seen it go bad. When I saw, people that are homeless or whatever, get someone to buy an insurance for them, and then send them to a treatment center and just milk the insurance company.
Yeah.
But the person, number one, doesn't really want to be in treatment. Number two, has no place to live, and that's why they said yes to it. And three, were promised things for it, like money or whatever. Yeah.
Money for being in treatment.
Yeah. Yeah. So that just pollutes your treatment center. That's just horrible. Hi, Kathy. How you doing? Oh, Skylar says hi too. Is that what it says?
Oh, very cool.
I can't read that far. You see that? You know Skylar.
Yeah, it's my daughter.
I know. That's my dog. Hi, Skylar. Make her talk. Anyway, all right. So what else is in the news? That's Dr. Sharma. Good luck, Dr. Sharma.
Yeah, we're rooting for you.
Yeah.
Well, that was.
We're not going to be putting up a campaign to help pay your legal bills, though.
No.
That's on you,
Something
brother.
tells me he's got it, though. Especially at $1,200 a test.
Something tells me that, yeah, he's got it.
Let's see what
We
else.
need to get his car.
Yes. You see, you're giving out information.
No, I just said we need to get his car. I didn't say why.
Okay. I'm going to leave it at that then. Because any further statement I would make would give out info. But come on, Robbie.
I think that's all. That,
No, it's not all of it.
Well, I mean, there was other stuff like there was more about the opioid crisis is now the leading cause of death for Americans under 50, which
Right.
that's what we talked about.
Right.
I mean, that's all.
Every show.
That's in the headline. Opana got pulled back by the FDA.
That's the big one.
Opana ER, yeah.
Yeah, tell us about that.
Well,
So what is Opana, first of all?
Opana is it's oxy or hydromorphone. Basically, it's stronger than even like oxycodone or hydrocodone, and it's extremely abusable. People can break down and snort it. Like they reformulated the OxyContin so that couldn't happen, but
Right.
Opana people are still crushing it and getting the high of their lives, and a lot of people are dying. And this is what's so expensive that you hear people selling their TVs just for one pill, and people are being led to heroin or death from this drug, and the FDA is starting to see that, and they're pulling it off the market.
And here's the thing, and this is where, when they stopped prescribing the oxycodone or the OxyContin, this is where they went to.
Opana went up.
Yeah, Opana just went through the roof. So they pulled that specific one. Not all Opana, just that one?
Just the
extended
ER, yeah.
release, extended release
Yeah.
one. Okay. And basically what that means is because once you break an extended release tablet, that means you get everything at once. That makes it a lot more powerful when you break it.
Yeah.
You really should never break it. One of my accountants actually passed away. Not because he did crappy work with me, but because he actually overdosed on his painkillers that were an extended release.
Wow.
Yeah. That was an interesting way to go for a guy that, number one, he wasn't an addict, but he was a guy that was disabled. He used him as an accountant for many years. He was in a wheelchair, and he did good work, and it was a little side business, so I liked supporting his hustle,
Yeah.
But did take issue with him when I shaved my goatee. He said I look less spicky.
Oh
I
man.
did take issue with that. That was
Yeah.
I would say, yeah.
That's hard. But talking about the Opana, I had a good friend that was in treatment that he was, I'm not going to say his name just because confidentiality, but
Yeah.
he was in med school, third year, getting ready to graduate, and he got really heavy into Opana, and that was the drug that sent him down into a spiral. And
Really?
yeah. He's doing well now, but
Right.
Opana really got him. Like
Yeah.
a lot of other people out there.
Yeah. So I mean, what happens and what's next? What you any ideas on what's the next one that's getting prescribed big? If so, OxyContin had its day, Roxy's had their day, Opana had its day. Now what?
I mean, it's up to speculation, really.
Really?
Yeah, I don't know. I'm not in the street game anymore, where it's all going around. So
We got to throw you back out there, Robbie.
No,
You got to
no.
go do some street work.
No, I'm done with my research.
You're done with field work?
Well, I've got one for you guys.
All right, you tell us. And let me say hi to Trevor real quick. Trevor Martin, how you doing?
I remember hearing this a few weeks back, and I don't think we ever really talked about that.
Okay, what's up?
And so consequently, I didn't do a lot of research, but I did pull up the article real fast because when I heard it, I thought it was very interesting. I don't know if you guys have heard in the news that the Ohio Attorney General is suing 5 big pharma companies over their role in the opioid epidemic.
Who's suing him?
The Ohio Attorney General.
Check that out. Ohio's always
Yeah.
working
I
on
thought that
something.
was, these are the bullet points just really quickly. It
Okay.
says Ohio Attorney General Mike DeWine is suing 5 makers of opioid
Nice.
painkillers for their role in the state's opioid epidemic. The 5 companies named in the suit are Purdue Pharma, Johnson & Johnson, Teva Pharmaceuticals, Endo Health Solutions, and Allergan or whatever. I don't know how to pronounce that one. This is the second suit of its kind brought by a state after Mississippi. So basically what they're saying is they, without reading the entire article, and somebody who read it, by all means, I'm sure you can further elaborate, but I know just a blurb that I saw, the premise that I took from it was when the opioids first kind of were introduced, essentially, a lot of these drug companies were telling everybody, hey, they're safe, they're fine, send them out there, lots of people, put them out there, they're good, and they kind of, fudged the numbers, essentially, with how dangerous they are. They weren't open and honest about how dangerous they were, so consequently all the doctors were flooding the market with all these pills, based upon the recommendations of the drug companies. And so now the attorney generals are essentially saying, okay, well, you know, we're always trying to hold the doctors accountable by saying, you know what you're doing and you're prescribing them. But what the attorney general is saying is, yes, maybe nowadays the doctors know what they were doing, but originally they didn't. They were given bad information from the drug companies, and so now we're going after the drug companies for putting that out there in the first place. I think that's very interesting because, you know, Big Pharma's got deep pockets, obviously. However, if they start to feel that they could get, you know, financially held accountable for this, they might change their practices a little bit. Who knows?
Yeah,
it's possible.
I see. Here's the problem I have with that, and whether it's a popular opinion or not, I'm not going to blame Big Pharma for this. I blame FDA. FDA takes years and years and years to approve every medication that comes through. So if something gets approved, even the language, a pharmaceutical company is not allowed to say anything about their product that's not approved by FDA. There are no pharmaceutical companies that ever came out and said this is safe. They can't talk like that.
Well, they did used to do those videos. Remember when they had people with chronic pain, like construction workers and all this, and they had a series of people, and they said how much better their lives had gotten because of OxyContin.
Well, here's the
but there's other language and other words and other things around the commercials. In other words, FDA what I'm saying is not that they wouldn't want to say a lot of things.
Yeah.
I'm saying they're
FDA
so regulated by FDA.
Right.
That we should hold ourselves, our own government, responsible because it's our government that allowed it.
Well, here's some of the verbiage. The suit, the suit which DeWine said is the second by a U.S. state after Mississippi, claims drug makers violated multiple state laws, including the Ohio Corruption Practices Act, and committed Medicaid fraud. And it goes on to say, in 2014 alone, pharmaceutical companies spent $168 million through sales reps peddling prescription opioids to win over doctors with smooth pitches and glossy brochures that downplayed the risks of the medicines. DeWine said at a press conference Wednesday, last year he said 2.3 million people in Ohio, or about a fifth of the state's population, were prescribed opioids.
Wow, a fifth of the state's population.
Again, all approved by FDA.
Wow.
All approved by FDA.
Well,
every single one of those brochures, I don't care what they say, I don't care how glossy they are, every single one of them approved by the FDA. And let me tell you what the FDA did to pharmaceutical companies. And I'm not trying to protect them, I don't like when we blame the wrong person. Because here's what the FDA did. You know that a pharmaceutical rep can no longer even leave a pen that has the company name at a doctor's office, as if that's going to change something. The pen. The pen. They can't use pens. They can't give away pens. So.
Well, I understand where they're coming from because I think back to the cigarette thing.
Yeah.
You know,
there's not a regulation though.
Well, there's regulation.
There's not an FDA for cigarettes.
What I'm saying though is the biggest thing with the cigarettes that they tried to go out and stop was marketing to kids. Like they weren't allowed to market in certain areas, so the way they were marketing was kind of unscrupulous. And so what they're saying is with these drug manufacturers is they're kind of bending the rules the way they're marketing and they're downplaying some stuff and
but again,
that's where they're going from.
There's no FDA approving those commercials for cigarettes, though. That's a straight from business to consumer. With pharmaceutical companies, there's a third party involved, which is the FDA, which they pay millions of dollars into. In other words, you're paying to be evaluated. You're paying to be held accountable. So if you fail to hold me accountable, shouldn't you bear some of that responsibility? That's what I'm saying.
Yeah.
You know, I'm not going to scapegoat the business because we know that you can't compare pharmaceutical companies to alcohol or tobacco companies because there's nobody regulating the alcohol or tobacco companies the same way that pharmaceutical companies are regulated. Nobody. It's not a food.
Yeah. Now, I guess my question would be with the FDA, they're the ones who approve marketing?
Yes.
Interesting.
Yes, they get every detail, and the only reason I know this, guys, is because I speak for Vivitrol.
Right.
So there's a pharmaceutical company that actually helps addicts get better with a non-addictive medication, which is why I speak for them. But the reason I know that is because everything I say is highly regulated. Everything that they give out is highly regulated. There's things that I wish I could say about Vivitrol, how great it is. While they are paying me, I can't say. Now here on the show, I can say all the things I want about Vivitrol and how great.
Yeah.
But when I'm in front of people, I have to give all the negatives. So in front of people, all their pamphlets and brochures, everything just says it has floods of whatever possible negative happened in a trial study.
Yeah. Adverse reactions.
All the adverse reactions, everything that could be possible, from down to a toothache. If one person in the study had a toothache, you have to say that this can cause a toothache. Even though one person had a toothache. Now, I don't know many addicts that are flossing their teeth while they're in their active addiction, but oh well, if when you're in recovery, you go, oh, I had a toothache, oh, that must be the medication.
Yeah.
Or you can't rule it out. So because you couldn't rule it out, it's on the list of things. Here's why I'm saying this. Go look at Tylenol. Go into your cabinet right now, pull out like Tylenol or Advil or Motrin or anything. Pull out the little insert and read all the side effects, the possible side effects. It'll freak you out.
Liver failure.
Yeah.
Oh.
Alcohol doesn't have to do that.
No.
You don't buy a 6-pack and it has a big insert. You don't buy a cigarette and it has a big insert. Here's what I wish FDA would do, and FDA could do this. And this is why I blame you, FDA, and I blame our own government. Because you could say, this is highly addictive. This can kill you.
Mm-hmm.
This can lead to death. Instead, they say habit forming.
Yeah.
They approve words like habit forming.
Yeah.
Who did that? Now, I don't blame a company for trying to push the boundaries. Every company out there, whether you're a landscaping company or whether you're a painting company, you try to push as many boundaries as you can. You know, how to get away with your taxes, how to pay employees, everything. I don't blame a business owner, a capitalist, for trying to push the boundaries. I blame for regulating bodies that allow it to happen. Because all of us we have to pay into regulating bodies.
Yeah.
You understand what I'm saying? So I'm not trying to
No, I
say
do.
Big Pharma is not guilty. I just think Big Pharma has always been that scapegoat that we've been able to get mad at. But without Big Pharma, we have no research.
Mm-hmm.
There's absolutely zero research into any illness, disease, or anything if Big Pharma wasn't involved.
Yeah, that's true. And all that being said, I think this is great with the Ohio, but I don't think the pain pills are being prescribed like they used to. I think there definitely is there's a downplay in that.
Right.
But the problem now is that since there's a lack of that you get all these fake pills in the market, and they have fentanyl, and that's how everypenny's dying.
Right.
Mhm.
So,
Well, that's what I'm saying. You're right. There's a lot of fake pills out there. You have all these different fentanyls. Oh my God.
yeah, carfentanil, sufentanil. Oh, okay.
Yeah.
Oh yeah, I'm sure it's got to be higher than that.
Yeah. Well, we're second. All these things come out of Ohio. Ohio beats us.
Mm-hmm.
I want to say thankfully, like we're a little bit lower than Ohio, but Ohio suffers just like we do. But what I do like about Ohio is they get really progressive with their attacking. So I don't mind them attacking Big Pharma because it opens the doors. But I also don't want newer pharmaceutical companies to be afraid to get into this space because of that.
Yeah.
We need pharmaceutical industry to continue to test things, but we need those governing bodies that ask for millions of dollars from pharmaceutical companies and make them wait 7 to 10 years and watch all their research. Then you do your job. You do your job.
Yeah.
Don't use the words habit forming. You're in control of that, not pharmaceutical companies. That's FDA. I blame you.
Yeah.
Anyway, hi Jack. Welcome. What do you say? Jack says he got his Now Matters More shirts today.
Oh, right on.
Hey, thanks, Jack.
Very
Yeah. What does it say? I got 2 to pimp at the gym. Jack Davis says he bought 2 so he can pimp them at the gym.
There you go.
Right on,
I like
Jack.
that.
Make sure to post a picture. If you bought a Now Matters More Foundation shirt recently, just go ahead and post it. Tag us in there. Tag hashtag Kyle Cares and hashtag Now Matters More. Tag us in it personally if you can, and then let us know because we'd love to see it. Repost it for you.
A couple of people have, actually.
Yeah, Katie got hers and Marissa.
Yep.
All right. So anyway, so I'm not trying to disagree on that.
Yeah.
I love that they're doing something.
See, I'm still looking up. I've been this whole time. I'm trying to find
What are you trying to
where
find?
it shows that FDA approves the actual marketing materials.
Everything.
I can't seem to find that.
Every single every word, everything that a pharmaceutical company puts out there is highly regulated. You know who else is highly regulated like that? I don't know. Can't explain that one. You know who else is highly regulated like that? Attorneys.
Right.
Attorneys. Now you know how they get on and they say outlandish things like this. This guy got me 6.2 million. Blah blah.
Yeah.
All those commercials are highly regulated.
Yeah.
They're highly monitored, so they have to get every word, comment, or anything they say approved first.
Right.
So again, I don't blame attorneys if there's anything in their marketing that bothers people, offends people. But again, they have a governing board that watches over them and allows them to do it. there's certain industries that do that and certain industries that don't. And I think that we need to be aware of that. I think that's what needs to be told, is that we need to be aware of that there's government bodies that are being paid millions of dollars to watch over certain
Well,
things.
see, the one thing I will say about the FDA, and this is because of my role in the fitness world,
Right.
I've had to look a lot into different FDA
Like
approved-
nutritional stuff.
Yeah, so that I've actually dove
Right.
deep into. So I don't know much
Right.
about the pharmaceutical aspect, but I do know about the nutritional. I think the flaw, if you will, in the FDA,
Right.
other than the fact of the obvious corruption that's
Right.
out there,
Right.
I think the major flaw is their process, and I have to assume that their process with the drugs might be similar to the process with nutrition, and that is, when it comes to nutrition, if we're trying to come out with like a new nutritional supplement or whatever it may be,
Right.
something that's regulated by them,
Right.
they rely on our studies.
Right.
So
Yeah.
if we go get a study
Mhm.
and we give it to them and the study is essentially false, they don't investigate the study and how it was done. They just look at our study.
Wow.
And we have to give them a few studies essentially. And so they look at the study and they look at the results from it, and then they make a decision based upon that. They don't always dive deeper in to see the way in which the study was conducted.
Well,
And they don't go to like a third party. Like what it is I come up and I say I'm going to come out with Trinity's whatever. All right. I can't do the study myself, so what I do is I know Robbie. Robbie's my friend. I'm gonna go ahead and he's a third party. I'm gonna go ahead and have Robbie do the study.
Right.
But him and I are really good friends, and I'm paying him a lot of money to do my study. So it's gonna make sure that the study comes out the way I want it to come out.
Yeah.
You're the FDA. When I give it to you, it says third party because Robbie's not part of my company. And so you look at it and says, okay, it's a third party study. You look at the results and you approve it based upon that.
well, I have one thing to disagree with that, and that's FDA does not approve any pharmaceuticals. Zero. No matter how many studies you do. They do no research or anything on a product until it kills people and there's a lawsuit. FDA is not involved in nutraceuticals. And I know this because I actually owned a nutraceutical company, had a nutraceutical on the market. You can get a third party to review it and call it, this passed the good manufacturing practices and get their little symbol on it. There's different, like, not governing bodies, but like bodies out there that will put their little symbol on it so it makes it look good for the public. You know how the organic symbol gets on certain things?
Yeah, which is all BS.
But there's a lot of organic symbols, and then there's the FDA organic symbol.
Yeah.
And the
That's what
FDA
we call
organic symbol is the real one,
Right.
and all the others are the fake ones. Well, all nutraceutical products have those other ones. Not one pharmaceutical product will have the FDA seal because they don't approve they don't approve nutritionals,
Yeah,
nutraceuticals.
That's what they all say on the back. This product has not been evaluated by the FDA.
Or
Correct.
for supplements.
Correct, for
Yeah.
all supplements and
Talking about food.
nutraceuticals.
Talking about food.
What food is approved by FDA?
Um,
No, they evaluate it after. Like, they'll tell you if somebody dies, they'll go test it, and they'll say has to be pulled off the shelf, because it has this many microbes of this. Or like, they put out rules, and they're the ones that will govern you,
Yeah.
but they don't approve it before it hits the market. Is what I'm saying.
It says
They
here,
don't-
although the FDA does not have pre-market approval of
That's what I said. Pre-market.
of food products,
Mhm.
it has the authority to approve certain ingredients before they're
Correct.
used in food. That's
Correct.
what I'm talking about.
Yes.
So like ingredients like aspartame, things of that nature.
Yeah.
Correct.
That's what I'm saying. So nutritional stuff.
But correct. So there's no. In other words, all that means is somebody hasn't died from them yet. In other words, FDA cannot approve every single chemical compound out there. So their real job on food, which is the Food and Drug Administration, the food part is very lax. The drug is very stringent and it's supposed to be stringent. The Food and Drug Administration, FDA doesn't
Sure.
review any food until people die from it. Once they start dying, they'll dig deep into that chemical composition, and if they find evidence that chemical has something to do with it being a problem, they'll pull that chemical compound. And that's why GNC every once in a while will have a product removed off their shelves, because like GHB
Yeah.
was on the market forever,
Yeah.
but it didn't have to have FDA
Well, they
approval.
did the same thing for ephedra.
Same
They
thing.
brought it back after a
Ephedrine,
while,
same
but-
thing. There's a lot of different products like that, but they don't pre-approve, like pre-market.
Yeah.
Well, with medication, the drug part of FDA is pre-market. You have to pass the rule.
That's the 7 years before where they do all
7,
that.
10,
Yeah.
it could be forever, man.
Yeah.
Yeah, and not just the time, but you have to meet their testing requirements, their research requirements. It has to be duplicatable by outside parties. It has to be. You have to turn in everything. And listen, I worked at a facility where we had testing going on out of that facility. There's people in there all the time in the books, talking to clients, looking at the research, making sure that all the research was done properly. So that's why I'm saying it, because I've had firsthand knowledge of actually seeing the way that process gets done, and I saw how lax it was when I put out Baseline Plus with a physician friend of mine. We were on the market. All we had to do is put 2 products that have not been on the do not hit list, right?
Yeah.
Put them together, had a company make it, put it into a capsule form, and had it on the market within a month.
Here's their verbiage off their website. It says new drugs and certain biologics must be proven safe and effective to FDA satisfaction before companies can market them in interstate commerce. Some examples of biologics that require approval are therapeutic proteins, vaccines, cellular therapies, and blood products. Manufacturers must also prove that they're able to make the drug product according to federal quality standards. The FDA does not develop or test products before approving them. Instead, FDA experts review the results of laboratory, animal, and human clinical testing done by manufacturers.
Yeah.
If FDA grants an approval, it means the agency has determined that the benefits of the product outweigh the known risks for the intended use.
Right.
See, that's ridiculous.
Right.
See, I don't like the testing done by manufacturers.
Correct.
That's what I'm talking about.
Yeah.
No, but listen, listen. I agree with that. Can there be more strict things? Here's the problem. We don't know what that really means as far as on their end.
Sure.
Yeah.
We don't know. I mean, humans are humans, right?
Yeah.
So like you said earlier when you said, you can go to Robbie. You know Robbie. Well, I don't know how many of these people are there. I don't know who the evaluators are. I don't know how they make their decisions, but they're still a human making a decision.
Sure.
So I agree with that. But when they get stuck in the verbiage part and the words part and real ridiculous stuff and not concentrate on, like, for years I've been upset with them using the words habit forming. You can't say this is or this isn't habit forming. This is not a habit. This is a disease.
Right.
This opens up a disease that you may have latent already within your genetics.
Sure.
And so when you have this latency within your genetics and all of a sudden you take certain products, it can open that up, and that enzymic type process, right, can all of a sudden open up a disease that you weren't supposed to have activated at this age.
Yeah.
Maybe at some point it would have been activated. It's almost like having the genetic predisposition for diabetes, but because of your eating habits, it came 20 years before it should have come.
Right.
You were probably already going to be diabetic, but because of the way you ate, it came early.
And it's just like because of these pills that release that much dopamine at one time.
Correct.
That's why it was released.
Correct.
Neurobiological pathways were
Correct.
Yeah.
But I can make this. Right, let's go back to simple litigation world. I can make this. This is a corkscrew. Why does Captain have a corkscrew?
God, that's like the
you
worst
ever
thing to pick up.
Get champagne in here or something? Corkscrew. No, it's actually a good thing. But if I'm an idiot and I stick this corkscrew in my eye,
God.
there's user error. And here's the user error with pharmaceuticals. You physicians out there that continue to prescribe painkillers to people that you know you're going way above and beyond the normal everyday pain treatment. Now you got to question their pain threshold. You got to question some natural things that aren't evaluated. Acupuncture, relaxation, meditation, sitting differently, basic work things. Hey, the way you sit, the way you cross your legs, the way you walk, you're inactive, you're not eating properly. There's so many things that doctors just say really fast that will all be better treatments for pain.
Yeah.
But none of those are evaluated. Like, what is evaluated? Like, everything you guys say as far as, like, workout expert, personal fitness trainers, you could say anything. You guys all disagree with each other.
True.
Right?
Yeah.
A lot of them. This guy says eat this guy says eat this guy says this is the best exercise, this other person's over there doing dancing all day long, this other one's doing boxing, and everybody has their weight loss and physical fitness
The
stuff.
biggest problem with that, especially when it comes to nutrition, there's no licensure for that. You can't be licensed nutritionist.
Really?
Yeah.
Well,
I didn't know that.
I thought, there is certifications,
There's certifications, but it's not
Right.
a license. In other words, it's
Well-
not a state certified license. In other words,
but it's a state certification.
no.
Who's the governing board?
There's certifying agencies, and there's a whole bunch of them. So basically, anybody can call themselves a nutritionist. In other words, there's no standardized test that the state agrees on that's going to stand behind it. In other words, you can have 8 different people who have 8 different nutritionist certifications from 8 different companies, and they all can say something completely different.
What about a dietitian?
There's a registered dietitian, yes, but there's not a nutritionist.
That's a state license, though.
For a registered dietitian.
What's the difference between a dietitian and someone that uses the word nutrition?
License.
Okay, so there's not a state nutritionist, but there are state dietitians, so that's what you want then.
In theory.
Is that what you're saying?
The problem with registered dietitians is they can't, because they're licensed, they can't,
Give you a meal plan?
well...
They're the only ones that can give you a meal plan.
Can do it, yeah.
Right.
But with them, the problem I've had with them in the past when I was trying to do like a website, I had this thing where I was gonna have experts on and stuff.
Right.
Is they can't comment really on anything that hasn't had like a tremendous amount of studies done on it. So
That's
they're
my
like,
point.
They're like 7 years behind anything that's out right now.
But
Wow.
you said all the key things that I said. 7 years behind. This is what I'm saying. We have a governing body we pay millions of dollars to.
Mm-hmm.
People are dying because these products keep hitting the market.
Yeah.
Let's not blame the pharmaceutical companies. Blame the damn governing body. Always being behind the times, taking forever to get things done, too much red tape. Figure it out and go faster. That's what I'm talking about.
And the other reason with the nutrition stuff too is just because there's really there's no proof, to be honest with you.
Well, there's no research that you know why? You know why there's no proof? Because there's no money in it.
Well, there's research that's been done, but the problem is there's a lot of correlation, but you can't really narrow down causation because there's so many factors that go into
Correct.
it.
Correct.
So that's why nutrition is such a hard animal to tame because of that. No matter what you want to say, like it's all correlation. There is no legitimate causation.
But if there was money in having something certified, like if I could have a certified banana that I could say I did research with, it does this, and it was approved by a governing body like an FDA, that would be a very different situation. But because there's no money in having any kind of certification for it, because there is none,
Right.
you get all these other things.
Yeah.
But that's what I'm saying. So with pharmaceuticals, we do have that.
Right.
This should never happen. Never should there be something on the market that we don't know. Listen, morphine is fantastic if I have to cut you open.
Oh, sure.
You want fentanyl. This is not an anti-fentanyl campaign. We love fentanyl. It's absolutely necessary.
Just not on the streets.
Just not the way it's being used.
Right.
You know what I mean? That's the thing.
Yeah, not fentanyl shipped from China in a tiny white bag. That's not the good stuff.
Yes, you shouldn't buy your fentanyl from I see. I almost used the wrong name. Cause see, being a Mexican, I'm very cautious of that. I almost said Julio around the corner, but I didn't want you guys to think Julio's selling dope. So John, don't go buy your fentanyl from John.
Yeah. Don't go on a street corner and buy it from anybody. I don't care what his name is.
No. Get it from the hospital when you really need it.
Yeah.
You know what? When you have a headache, you go next door to Billy and say, "Billy, I got a headache. Can you make me an aspirin?"
Yeah.
No.
Billy goes like this. Here you go, man. That's Billy. Can you make me just a little? Can I have a bump of aspirin?
I keep going back.
I need a little bump of aspirin, Billy.
I keep going back to the guy from Maine, the one that.
Which one?
The one that said that. It was the people coming up and getting the white women pregnant and stuff.
I was thinking the same thing when I said Julio.
Yeah, that's what kept going through my mind.
And he says Slim Joe or
Something like that. Yeah.
Shifty or Swifty.
Yeah, he kept telling me weird name.
He's weird.
All the black people come and get the white women pregnant.
Yeah,
Wow,
that was a crazy,
Yeah.
racist guy. That Robbie just went and visited them.
Yeah, shout out to Maine.
Shout out to Maine.
It was gorgeous.
Did you go get their white women pregnant, Robbie?
No, I did
Of course
not.
not. He's not the black dude with the drugs.
That's right. That's right.
Oh,
Yeah.
jeez.
I didn't see very many black people in Maine.
That's what they said.
Yeah.
That's why they blame their problems on
Yep.
black people.
That's ridiculous.
So
We're talking about. It was
crazy.
just like a. I can't remember if he was a mayor or.
He was like a governor or
It was
something. wasn't he?
somebody political
Right.
who got
So much
who,
for our
who
memory.
came out and said that essentially that he came up with these two like crazy random like street names.
It was like Shifty. And
yeah, like
something.
some stupid name. So they're
Lefty
coming up here
or something
and
like that.
They're the ones that bring the drugs in, and before they leave, they get our white women pregnant.
It's like
That was
He
just-
said that.
Yeah.
Before they leave, they get our white women
Yeah.
pregnant. What the hell did you just
Are you
say?
kidding me?
No, he said
No,
that.
that was legit from
That
a
was legit.
politician.
Dude, we played the soundbite. Where's that soundbite?
Yeah, I don't know.
We need that soundbite.
Wow, that's crazy.
That's crazy that he would say that.
So when you were talking about getting your drugs from such and such, that was the first thing that went through my
I
head. It's
know,
like,
that's
okay.
why I got to say names like John and Bob and Billy, because those are like even us first generation or people that have just gotten to this country use names like John, Bob, and Billy.
I knew a CRNA named John that was an anesthesiologist. He put people to sleep,
Yeah.
and he ended up in treatment because he was passed out on sufentanil. He was using it on himself while he was operating.
There you go.
Oh wow.
Yeah.
Yeah. Well, we had one the other day at our treatment conference that said that. That
Yeah.
back in the day, and now he treats people, but he was actually injecting himself with fentanyl,
Yeah.
and then doing surgery.
Not safe.
You know, I mean, this is look. again, we can always blame the suppliers. It may be, again, I could be wrong, people, I could be wrong, but I don't blame suppliers. I blame demand and regulation. I don't blame capitalists from doing anything capitalists do, because I think everything out there has a monetary value. So you know, to regulate that is a little weird, but to allow it to be as a product, to allow it to go, especially if you charge me to evaluate me. If you charge me to evaluate, and you messed up, and I follow the rules, you can't blame me. If I follow the rules, you can't. You shouldn't be able to blame.
You're saying if you were prescribed a medication, you took it as prescribed?
I'm saying, yeah, if you make a medication,
right,
the doctor prescribed it legally, and I used it legally.
Yeah, you took
then
one pill
the blame is the disease.
Yeah,
the blame is the disease.
Sure.
You're not to blame for creating it, because it's actually useful in some cases. The doctor's not to blame because he prescribed it for me because of these set of symptoms that I proved to have.
Yeah.
And I'm not to blame because I didn't know that it was going to do metabolically what it did.
Yeah.
However, same scenario, put a bad doctor in the middle. That I don't really have those set of symptoms, but he kind of says, so you have this, this, and this, right?
Yeah.
Right?
He knows it's going to make you feel. Yeah.
Right?
Right.
We've seen how many private camera,
Oh, I know.
you know, where they go, all right, so you have problems sleeping, you have anxiety, you have this, right? And the client goes, yeah.
Yeah.
So now who's to blame? Is it you, pharmaceutical company?
No, it's the doctor.
Okay, good.
Yeah.
All right. So, or if I go to multiple good doctors and get the medication, who's to blame?
The patient.
The patient. So at no point in there, unless you right there put something on the market and you paid the FDA evaluator. Now, if I could find that you paid and falsified your studies and research, that's when you're guilty. Now, if they can say that, I'll blame pharmaceuticals.
Well, I think what they're saying is just the shady practices of downplaying the bad parts and stuff like that.
They can't. You can't downplay the bad part. I'm telling you, legally.
According to the lawsuit, they are. So.
But you can't. And so you'll see, pharmaceutical companies will win that. Because you cannot downplay it, because 50%, I mean, as a matter of fact, it's like, I don't know if it's 50 or 60, I don't know what the ratio is. There's a ratio that you have to say all the negatives.
Right.
In all advertising, in all your things. So, it's just like those car dealers, they allow that. Look, can you read those little words? At the end of every commercial? Every pharmaceutical commercial and every car commercial does the same thing.
Sure.
With all those little tiny words, you know, and I got big screen TVs and I still can't read the damn little words. And I say, right? People get paid a lot of money to talk really fast.
Or they just talk slow and they speed it up.
Whatever it is.
Yeah.
But it's real itty bitty on the screen.
The micro machine guy.
Right? Now, for you as a governing body to say, oh, you have to have this on, that's the stupidest thing on the planet. Why do they have to put all those little words on the screen? What consumer out there is able to read all those little words?
No, you're right.
So to say to make me feel good and to justify me asking you for millions of dollars for me to regulate you, I'm going to say, but you have to put those words on the screen.
Yeah, it's not doing anything.
That is the stupidest regulation on the planet.
Yeah.
No, you should come in and say, this has the potential to kill you. If you have the genetic predisposition for addiction, or should you take these medications for a prolonged period of time, you have the risk of not only getting addicted to this medication, but then moving on to other drugs on the street, such as heroin. So please be advised. Be closely monitored. You know, stuff like that. Say that.
Yeah, but they're not. That's
because FDA is not demanding that.
But that's
what the FDA is demanding is you go.
I mean, I don't know. I'm not sure if I personally see it quite as black and white. I guess I don't think it's blame just one. I think they all share a certain amount of accountability. Like, I don't think we have to just choose one. I think the FDA needs to do a better job of regulation and do a better job of common sense regulation, I guess. And I think that in holding people to the standards that they've already set, I guess. I think that the actual drug manufacturers, I think they know what they're doing. I think they cut corners when they can because they're trying to make a buck. So I think they could be held a little bit accountable. I think the doctors who know what they're doing, who are prescribing things improperly, could be held accountable.
Right.
I think the person who's going to multiple different pharmacies to get what they want can be accountable. I think there's enough accountability to go around.
That doesn't really happen anymore, though. The doctor shopping.
Right.
Sure.
Right.
Sure.
Well,
because of the pharmacy.
Unless you know which doctors don't go on. What's that? Oh my God.
The
system
software
that connects them all.
Forgetting. I can't believe I just forgot that name. I spaced it. Somebody out there is going. Hey, it's
My sister right now is the one who's saying it.
Yeah. But anyway. you're supposed to do that and you don't sometimes. If you know the doctors that don't, you can do it still.
Yeah.
All right. My point of why not blaming pharmaceutical companies, that's almost like blaming Mother Nature. Or blaming other people. In other words, you're supposed to push that envelope because sometimes to cure a very bad, like cancer treatment has to try to kill you to kill cancer. You literally are dying in order to kill that cancer. We're putting poison into people that take them to the brink of dying in order for them to beat that cancer. So that kind of research is already so highly regulated. And I'm not saying there's not companies that go around it. I would think every single one of them breaks the rules somewhere. I would think.
Sure.
Yeah.
Just out of national,
Well,
I mean,
billions of dollars.
just for natural thought process, right? But their job is to push that envelope so far because they're trying to cure the impossible. Because that's how you can really make the billions, right? In other words, if I had a drug on the market right now that actually could cure cancer, how much money would that be worth? So think about how far I really have to push that envelope.
Yeah.
You know what I'm saying? Just think, if you're a business person, you're going to push that envelope as far as you can. And for me having to test rats and mice, and there's people that don't even want me to test rats and mice, monkeys, there's people that don't even want me to test monkeys. I definitely can't test it on people until it reaches whatever phase of research.
Right.
So how the hell am I supposed to do that? How can we cure cancer, or how can we cure addiction when all the regulation is so on the front end where I can't even test it on anything?
Yeah, I mean,
I get that, but last time I checked, Oxy doesn't cure pain. Like, it doesn't
Well,
cure.
I just
Like,
went to a cure part.
I know, but and I agree with those things, but we're not talking about that. We're talking
But
about
Oxy does treat pain.
It treats it, but it doesn't cure it.
But it-
Like,
Yeah, but it treats pain a hell of a lot better than just will.
Very short term, though.
Very short term.
Yeah, I mean,
Yep.
there's plenty of studies out there that if you take it long term, that it worsens your pain.
Correct.
Yeah.
Because it pancakes your receptors.
Yeah.
And as soon as it pancakes your immune receptors, not even, now your endogenous, your own natural opiates don't work
Right.
like they used to.
Right, and this
you
is
need
people-
your endogenous opiates to work.
Exactly, and and this is the people that you hear about that they had surgery and
Right.
they took them for a
Like tolerance.
little bit too long because
Right.
the doctors prescribed them
Right.
legitimately, and then they have legitimate pain because of the painkillers.
All right, so Jack Davis asked a question there. Can you read that? It says something about why, and we kind of touched into that, Jack. Cigarette ads get attacked because there's no regulating body that even put them out there in the first place. And we attack them because once you beat them, now you can really attack them. Now look, alcohol companies should definitely be, I don't know how alcohol companies can still do what they do and cigarette companies paid all the price. That's a great question. How is it, I know why pharmaceutical companies have to do what they do. I know why tobacco companies have to do what they do because there's already litigation and they've already lost. But that's a great question. Alcohol companies can still say whatever the hell they want.
They just have to say drink responsibly.
That's it. And drinking responsibly means handing over your keys.
Yeah.
There's no ad that says drink responsibly. Please don't drink more than 3 of our product.
No.
Yeah.
No.
Have you ever seen an alcohol ad that says please don't drink more than 3?
No,
Never.
it'll never give you a number. It'll never say don't drink
Never.
more than 10.
It just says
Ever
responsible.
give you a number.
Yeah.
Just responsible.
It will never give you a number. But instead, it makes it look like if you drink alcohol, you're going to have great sexual encounters.
Yeah.
Well,
You're going to be very
have a-
attractive, you're going to be very sexy,
You have a great night.
and you're going to have a great night.
Best night of your life, yeah. Every single time you drink. That's
Now,
what it looks
why they
like.
don't regulate that?
Yeah.
Well, my favorite one.
I don't know.
My favorite one now is there's a certain one which I won't give them any advertising, but there's a certain one who's focusing on my people, the fitness people.
Oh, I thought you meant white people.
Right. I saw that yesterday. They're doing CrossFit, they're doing runs.
Yeah, there's a fitness beer now.
Yeah.
Like, oh, you're fit, you're healthy. This is the beer for you.
Yeah, you
Like,
work
wow.
out hard, you deserve
That's
this.
funny.
Yeah.
That's funny.
So now, not only are you going to be able to have more sex, have a great party, and have a great time, and make memories that are gonna last forever,
Yep.
but you can also be amazing with 6-pack abs and be a chick.
There you go.
Drink, drink, drink.
That's what you should drink then.
I've been seeing that one everywhere.
Dude, that industry, I don't know why. See, that's what I'm saying. We blame industries, blame ourselves. We're allowing that industry to do it. You know, we can go attack alcohol and go, hey, alcohol. No, we allow that. Lawyers can't do that. Tobacco companies can't do that. Pharmaceuticals companies can't do it, but alcohol companies can? Who is allowing that? Look, man, this is the thing. We want big government when we want big government. We don't want big government when we don't want big government. We're so divided as a nation on these kinds of rules, it's ridiculous. You know, it's like we don't want someone following us. Like, Elvie, I'll pot you up right now. Elvie, like, Captain and all them are at the conference right now, right? They're at the
Yeah.
convention?
Yeah.
All right, so I went to the convention, right? And the convention is this electronics convention, everything audio and visual.
Yeah.
All right, so the first badge they give me is a non-media badge, even though I have a media credential, but they give me a non-media badge. Do you know what that non-media badge had connected to, the plastic?
A chip.
A chip. How'd you guess that?
Just common sense.
Common sense. Did you guess that, Robbie?
I
common
definitely
sense.
wasn't gonna guess that.
No, it's not common sense. That's a great guess, actually. That's a great guess.
You're
Anyway,
just advanced.
I've never
Maybe
been to a
second.
conference where they put a microchip on the badge, because you take them home.
Oh, that's creep. Yeah, I would have tossed that thing as soon as I left.
You take them home.
Yeah, nah, probably would have been in the
It
car.
had a freaking microchip on it. So, the show's over. Anyway, adios, amigos. It's time for a taco. We appreciate everybody for being here and joining us. Sorry for going on a little bit long, but I couldn't help it, man. There was a microchip. I wasn't even looking at the time. I got to go. Have a good one.
I'm gonna start doing those Bilderberg conspiracy theories and stuff.